I want to thank everybody for joining us. I'd like to introduce myself, Lee Fithian, in the College of Architecture, Division of Architecture, and Director Elizabeth Pober of Interior Design in the College of Architecture. We'll be doing this presentation that we have for you today. Will be related to from city to room, the use of light and air to address air quality and airborne diseases and their impacts on design and the environment. To start, I want to make sure that you understand that we're doing historical examples to sort of learn from what we've done in vernacular and in the past. So we'll have a set of developments in their influences, but also draw from them to see how we can use that as a response during resiliency and COVID. So with that, I'll just begin. Recorded history shows a multitude of city and building design requirements to address the spread of disease. And this seminar will share some of those latest design interventions in the era of COVID-19 that are leading to changes in urban design, buildings, and interior spaces. Like I said, let's start with a little bit of history. When we have these great developments in the course of urban design, as we went up instead of just spreading out, initially skyscrapers were considered a serious menace to public health. In the early 1880s, they said that the tall office buildings were turning the streets below into dark and damp and gloomy canyons. There's lots of reasons for that, but in general, people wanted to point the finger at skyscrapers. And during the winter, they blocked the sun sometimes, leaving the cold streets even colder. If you listen to some of the great urban designers from Northern European areas, they'll tell you that design for the sunny side of the street. American Architect and Building News said they acted as storehouses of heat back then, driving up the temperature after sunset, making the once cool and refreshing nights unbearable. And today we know that it's urban heat islands, and it has to do with the materials that are used. And it's not just skyscrapers contributing to that. So the skyscrapers deprive both the streets below and adjacent buildings of fresh air and sunlight. So people were objecting to that.
So talking a little bit about New York City in 1901, some Americans still really believe that disease was a product of the miasma, which are these noxious vapors that permeated the cities, and that a lack of fresh air was considered a disease vector. So you can imagine with the skyscrapers and the impact on the air in these canyons, it was a big problem and a big concern in New York City. For Americans who believe that this new germ theory of disease, this lack of sunlight was also a contributor to disease. And sunlight was described by doctors as the best disinfectant, the best bactericide that would kill the microbes that caused disease. Sunlight and wind were as vital to public health as water, argued a representative of the Chicago Medical Society in 1891. Without them, they said, life would be almost impossible in crowded communities.
So in response to that, initially downtown CBD, New York City had zoning law and districts associated. The commissioner's plan of 1811 had it was just two-dimensional. The skyscrapers weren't quite there yet. So they were talking about a rectangular grid, broad north-south avenues, multiple east-west, standard units, blocks of 200, 600 to 800 feet. It was a surveying tool. The Romans have done it since history, but they initially had it blocked out like this to set up the building. But with the advent of skyscrapers and them coming in and creating this horrible situation in the streets below, 1916, there was a commission put in place on building districts and restrictions on what can be done. And it was a board of estimates in New York. And that 1916 zoning resolution established two types of regulation: the separation of uses by districts and restrictions on the height, bulk, and area of buildings. So maps of the entire city were prepared that indicated that the regulations govern development at any specific location. And it also determined that the city's three-dimensional form was restricted by uses by district, and especially by limiting the mass of a building allowed on a given site. So if we're looking at this, we're going to see that we've got this sort of angle going through, and there's calculations about how wide that street was and how far up it had to be for that to be considered and put forward.
So, mass is the key here. Think about mass, not just height, but mass being important. And you can really see that translation in these images here.
Right. So what we've got is the Shelton Hotel on the left, the Barclay Vasey building on the second to left, the New York Telephone building, and the New Yorker. And designers use this term mass a lot, but what we talk about when we're using mass is we're talking about these big volumes associated with that. So we've got this larger mass down below, but then it stepped back and comes up, and then this mass steps back from this mass, and then these masses step back from those. And that point is to bring that angle down into the street to allow that light and air to come in. And you can see it over and over again, all these sort of staggered blocks that are coming in. And we have one of those in Oklahoma City. It's being remodeled as well at this point in time.
So in addition to this shape and form and this massing, tapering of the buildings as they went upward, we also had skyscrapers that were drawing from classical architectural references that would help to shade and cool and circulate air within the inside of the building. So classical towers in Chicago and New York all really took their shape from this need to create workable environments inside where people could work and live prior to the advent of air conditioning. So the first skyscrapers were created with ventilation and airflow in mind. And you can see in the image that we're showing you here, these open courtyards that were designed in between different sections of the building, these thin profiles that allowed windows to be placed on either side of these spaces that would help support cross ventilation. So we oftentimes saw buildings shaped like C's or buildings shaped like E's, which are similar to what we're seeing in the image here, or even thin, narrow, long buildings, which really help support this cross ventilation. Not only cross ventilation, but also daylight, allowing that daylight to come in on either side, easily permeate these interior spaces, and of course support this natural airflow from the outside in prior to air conditioning being integrated. Inside, we see the impact of the windows that I was just mentioning. These windows were all operable. They opened. We had windows going all around the perimeter of these spaces to really help support airflow and encourage ventilation. You can see in the image here, these high up thin windows. Those are called transom windows, which also helped with airflow. And in addition, of course, these windows were important for bringing natural light into the space. Because of the way that these buildings were designed and set up, this air and light was able to really fully permeate the interior of the building all the way into the core of these spaces.
Right, then in a great move towards productivity in the 50s, Carrier invented some air conditioning. And at the time, those operable windows sort of like weren't necessary then, and curtain walls were invented, and we had steel and we had glass. And the penultimate first example of that is the Lever House in 1952. Skidmore, Owings and Merrill, it's 24 stories. It's sea-colored glass box. It presented a total environment for work. And employees could enter through a large ground level plaza or underground parking garage, eat in their cafeteria, work in an office that's kept cool and clean by air conditioning. and mechanical ventilation. This first glass curtain wall building was literally a revelation, and passerbys could glance near the edges of the building and see out another glass wall around the corner. Employees didn't have to breathe the same air as New Yorkers, and the hermetically sealed exterior cut down on heating, cooling, and cleaning costs because less city dirt and dust made its way through the open windows. And so when we're talking about this, we're looking at, you know, this green building here, and everybody, you know, it's modern, right? It stands out so much from the traditional ones that you see around. And so it was revelatory at the time, had this plaza and area, and none of these windows work. None of them were operable. When we see them today in drawings by architects, they're not showing really these. You have to have shading systems because those are necessary to prevent glare inside. That transom light that came in the older buildings wasn't there, and totally dependent upon mechanical ventilation to work.
So what you see here with the sprinkling of all of the shade systems that are interrupting, you know, this beautiful sheet of glass on the outside is, of course, a result of the occupants of the space and their actual needs for whatever activities they have happening in there, whether they want privacy, whether they want, you know, daylight control. And of course, you know, shading systems also impact temperature control sometimes to help regulate temperature control in a space.
Sorry about that. I was trying to get rid of my marks on there, and it just popped forward. I'll go back. Hold on.
Nope, that was all. I said the last piece there. Go right ahead.
All right, great. Thank you. With this mechanical ventilation, all sorts of things happen. People talk about productivity, but you have to remember, as you know, energy usage increased. They worked on really efficient stuff, and they brought you know, took into account that they were controlling the energy use in the building. But at the same time, you close this building down. No matter how efficient those systems are, you're dealing with a resiliency. If the power goes out, we have a problem. If we have natural conditions that allow on a beautiful spring day like yesterday and some of this morning, opening the windows is kind of impossible. So when we have that sealed building energy, you need to understand that even with the efficiencies that we've developed, cooling of buildings in the United States contributes to 500 million metric tons of carbon dioxide emissions every year. And a large of that part of that is due to indoor climate control. And buildings utilize half of the total US energy consumption. So when we shift back to vernacular, when we talk about previous ways of doing things, it's not to get rid of all those systems. It's to go back to ways of not just forcing it to work through a system that we've come to realize, perhaps think is the only way to do things. Because artificial cooling has become such an energy hog that it's detrimental to our efforts to fight climate change. And skyscraper design has begun to shift back towards vernacular techniques used in pioneering buildings of the late 19th century. They're starting to see operable windows. We're seeing access to balconies with natural light and fresh air. And there's also access to vistas, nature, and plants, bringing those back in the urban area, not just because we like the way they look, but they actually is a reason why we like the way they look, because they have really positive impacts on our stress. So one of the other things that they're turning back to and looking at, and especially in this era of COVID, is what had already been designed and developed back in modernism to combat our understanding of not a miasma, but this germ theory and the cause of tuberculosis. So there's a really strong correlation between tuberculosis and modernism, and that's in the light and air and the sanatorium design. The first tuberculosis sanatoriums in the United States, it was founded by a doctor, actually had consumption himself. That's another name for tuberculosis at the time. And it was in upstate New York in the 1880s. A key feature of this building in this center was a glass enclosed deck known as a cure porch. Tubercular patients would spend much of their time resting on recliners on these porches, even under layers of blankets during the winter months. And that's a key feature because Yes, it gets cold. We want to have everything perfect temperature, but you know, everybody's body responds differently, and adding a sweater or taking off a sweater really helps contribute to that range of what mechanical ventilation can do. And we don't have to heat so much, we don't have to cool so much. And one of the other parts of that were those balconies. So this design and construction of specialized sanatoria coincided with that modernism start. Elements such as flat roofs that could extend, terraces and balconies, white or light painted rooms spread across most of Europe, not so much here. Not unlike the sanatorium, the new architecture was intended to cure the perceived physical, nervous, and moral ailments brought on by crowded cities. So part of the appeal of that flat roofs was that extra outdoor space they created, which could be used for sunbathing, which was then known as heliotherapy. And in 1925, Corbu dreamt of a city where every citizen's house was whitewashed and hygienic. There are no more dirty, dark corners, and everything is shown as it is, the inner cleanliness.
One thing to note here with this example is not only are these balconies and terraces providing outside fresh air to the patients, there is a significant amount of glazing or windows that helps bring natural light still into the inside. But the way that the roof structure is designed and extends on to protect the balcony and create this semi-enclosed space, it also helps with shading so that the intensity of the light coming into the inside of the space is not as intense. So again, back to these key features of natural ventilation, fresh air, daylight being important components to healing.
Also, we have Alvar Aalto's Penyo Sanatorium near Turku in Finland. It was opened in 1932, 7-story building, had balconies at the end of each residential wing, so weaker patients didn't have to go so far to reach them. And patients who were more mobile took the sun and fresh air on the roof terrace.
Yeah, the bottom image here shows the roof terrace, and you can see that there were planters that were installed to help bring the patients directly close to nature. At the time this was built, of course, there were trees and things surrounding, but at this high level, the patients didn't have that immediate connection to plant life. So they were trying to encourage that and realizing and recognizing how nature does play an impact on the healing process. And the patients that were located at this facility spent a significant amount of time outside on these balconies and porches.
There's a lot of space included in that as well.
So the rooms in this facility were fairly small. There were 2 patients typically that shared a room. And Aalto was not only focused on designing the building itself, but he was also very focused on the details of the interior of the building as well. He designed fixtures and furniture to help assist with the healing process. And one of those fixture components that he designed was the Pymo sinks that we see up here in the upper left corner of the slide. Hygiene was a very important component, of course, to healing and to helping the patients to protect themselves. And so hand washing was something that was very much emphasized. Of course, we're all experiencing that now in the era of COVID. But in these rooms, each patient had their own sink. And so you see here 2 sinks side by side. To allow each patient in the room to have their own sink. And they were designed in such a way to help minimize sound, so that if a patient was sleeping and the other patient came to use the sink to wash their hands, the noise of the water falling into the vessel would not wake up or disrupt the other patient in the room. The shape of the vessel was also designed in such a way to help minimize splashing and the spread of germs. And this idea of fomites in general being anything where we have doorknobs or any sorts of objects that could carry infections, even clothing, fabrics, hard surfaces, soft surfaces. So he was very focused on those elements as being important as he designed these components and pieces. Another piece he designed was the PIMO chair, which is bent plywood design. Of course, this was easy to clean for the patients that were sharing these chairs. And it was designed in such a way to have an angled back that would help support the patient's breathing so that they could breathe easier when sitting in these chairs. And oftentimes these chairs were brought out onto these sun decks and balconies for the patients to sit in while they were enjoying the fresh air during the day.
So that's part of our sort of historical overview, and now responding to not just COVID, but climate change and issues associated with it. And what are some of these lessons that we've learned from all of these? So Hurricane Sandy was an eye-opener in New York City. It was big time. Building science supported code changes that aided in the Sandy recovery. This was published by FEMA in 2014. You can see here a flooded entryway into a subway. The plaza along Water Street in Lower Manhattan was flooded after Sandy hit. There was severe damage in New Jersey, and particularly New York was flooding streets, tunnels, subway lines. They were cut all the power in and around the city. When the power is gone, mechanical ventilation can't operate due to the power outage, and there's no way to get fresh air into the buildings. The buildings turned out to be hot, humid, and there's a buildup of CO2. Mechanical ventilation is there. It's supposed to control temperature. It's supposed to control humidity. And CO2 is one of the sensors that they put in there to trigger operations when that builds up too much. And that's really what runs the whole thing: temperature, humidity, and CO2. And there's no way to remove it. Since Sandy, we see now that curtain walls, and this happened in Europe a lot, but you couldn't force ASHRAE in the United States to do it. They wanted to have control of the building operation systems. So they now have operable curtain walls, designated areas with windows that pop open, that allow for fresh air in times of whenever you want, but also in times of the power outage. They had recommendations. This is along the High Line, this particular building, had recommendations in that report by FEMA afterwards to raise minimum elevations, put them up on plinths, protect entryway to public transport so that, flooding situations don't cut off that access. Emergency power is important, but that would normally just be for lighting. It takes a lot of energy to have mechanical ventilation going in a building with emergency power. And requirements for water access in public areas for residential buildings more than 5 stories tall. There's no reduction in the windows called for, but resiliency for operable windows during power outages, which allow for ventilation. And you can see it in this with a glass wall, but those adjacent buildings have opportunities as well.
Yeah, so we often saw buildings transition from operable windows to fixed windows. The building that you see on the left of the slide of the main building in the image, those windows could have been operable, then moved and replaced with fixed. And there's opportunity now to change those and put operable windows back in to, again, allow for this transition for the need for natural ventilation. Even the building you see on the lower right of the image here, where we see, balconies, it's a fire escape, but again, that connection to the outside, still providing those windows that will be operable and open to allow natural ventilation to come inside the building.
One of the other things that happened during modernism, and you've probably seen a huge trend, and we're going to offset carbon dioxide by having more plantings in urban environments. That response is not necessarily just triggered by that. When we go back to this naturalized environment, tuberculosis, modernism, and whatnot, it wasn't an accident that PIMO was built in the middle of a forest with vast amounts of outdoor balcony space, oversized windows to allow patients to look outside year round. Whether you're in the mountains or a beach, Desert and Tucson's particularly popular cure spot for tuberculosis. The natural environment surrounding the sanatorium was carefully considered, and remote sanatoria got patients away from the dirty, crowded cities, but also provided them with beneficial views of nature, which was another focus. Corbu said he had a flat roof on many buildings, but he also had a view of the pastoral landscapes. And the landscape as a healing element is a very, very important to the modernists themselves, and the whole idea of bringing that outdoors to the indoors. And what most people recognize the upper left is the Villa Savoy, because that picture is what's in all the books or in the slides that people take. But on top of that is a very lush, very rich outdoor space that is lined with greenery. And that has impacts today as well for what we do in design. Since the mid-1980s, there have been a number of quantitative attempts to examine this theory of stress recovery theory. Stress is measured by capacitive skin resistance and blood cortisol levels. Stress reduction almost immediately in the presence of these naturalized environments, whether it's a photo or a real naturalized environment, was reduced immediately. Studies found that in other aspects of everything was kept equal. The patients with a window that looked out onto the trees had fewer surgical complications, healed faster, and required significantly less pain medication than those whose window faced a brick wall.
We've even found that this has been so impactful that hospitals that had rooms that looked out onto views that were not oriented towards areas of nature, that there's even been attempts to put a film over the windows to give the illusion of trees being outside the window, because this impact, again, of not just a view to outside, but a view that encompasses elements of nature as being so important to the healing process.
Right. So we have what you see on the left is a hospital atrium that has opportunities to interact, but also just view out into that space. It's not only just bringing light into this area, but this view shed, much like those, you'll see buildings with balconies that have plantings on them and whatnot, bringing this into the interior of the space to distribute that effect and reduce stress, which aids.
This helps also with something we talked about earlier, with the actual shape of the building itself, so that we're looking at sites where the windows and the views are not just oriented around the perimeter of the building, but we actually remove sections or a portion even of the middle core of the building to provide this light well and this atrium space to, again, connect those more center areas within the building itself to still have those views of nature outside, to still bring that natural light into that middle core space of the building that might not be connected to the exterior surrounding edges of the site.
Right. So we're going to jump ahead to the COVID response and what's been happening since last spring.
So last year, when everything COVID began, the CDC first started talking about all of the rigorous surface disinfecting guidelines. And at this point, they were really, we were all just starting to really try to understand the disease transmission process for COVID and how these fomites would be impacting our spaces that we were working on. Again, how the disease would carry onto surfaces of doorknobs and that sort of thing. So everyone was very much concerned about that transmission factor at that point, bacteria on surfaces. So the transition then started looking at droplets spreading and space needs impacts based on that. Initial requirements, of course, were 6-foot spacing, trying to separate people and move people apart to provide more space for those bacteria to not spread onto other people's surfaces that were nearby. We also saw a transition into recommendations for one-way circulation. And all of these things made a huge impact in terms of space needs inside a building. We could not have the same densities of the number of people using the spaces that we had in years past. If you look at the image here, you can see 2 studio spaces in Gould Hall. The one in the upper left being an existing studio space where we had 70 desks for 70 students, and then the larger one on the bottom after this planning for the 6-foot spacing and the one-way circulation, where we went from 70 to 42 students with the capacity. Then as more was studied about COVID, there were suspicions that it was more of an airborne transmission rather than the bacteria and the fomite transmissions from there. So we began to really think about that airborne transmission and the impact that mechanical systems played. And of course, as we've mentioned before, these mechanical systems impacting temperature, humidity, CO2, controlling all of these conditions inside the building. But these mechanical systems are not only designed to heat and cool, control humidity and CO2, they're also designed for a certain capacity to be able to control these things and manage these things and regulate these things for a certain number of people using a space. So that was something that we really had to look at as well. What were these mechanical systems designed for originally? And the last piece here being the direction of the air movement. Which way was the air flowing? So we have supply air and return air. We have air coming in that has been conditioned and filtered. The nice fresh air mixed with exterior air coming in from the outside, that air being blown into the space, and then the used air that is being sucked out of the space from there. And we have to look at the way that air is moving throughout the space to understand how it's going to move across and move around the people that are inside these spaces. So these became driving factors in terms of how we were determining the best ways to design our classroom and studio spaces to help protect and support our students and faculty.
Right, and Elizabeth and I, when we started collaborating on these things, we brought some experiential design issues associated with it. We both watched upper respiratory flu work its way through our studios in the wintertime. So we sort of were familiar with that effect of respiratory infection spread. My background in industry is military work with dormitory housing and ventilation standards for those. We have readiness criteria. We can't have a whole platoon be out because of an upper respiratory infection. And then, my ongoing research with air quality associated with that. So as we move forward into, after the layouts, moving into addressing and considering this airborne, CDC's coming to that realization, we're trying to stay ahead of that. We looked at our own building on the OU campus. It's sort of a microcosm of the different situations that would ordinarily be found in all the buildings across campus. It was designed to code, meaning ASHRAE and the building code requirements for education and classroom ventilation were followed, has a variety of use situations that are all addressed differently, and it's completely dependent upon mechanical ventilation. I have 2 videos I'm going to share with you on one of these rooms that illustrates what happens, basically where air is breathed out by people. And I used a standard smoke generator, which simulates temperature and volume of human breathing. I ran it for 10 seconds and filmed that movement of that smoke through the room. And for this seminar, I have examples of the same studio that Elizabeth was talking about with an air handling unit. And it shows while it's idle and while it's operating, and then adding the efficacy of a HEPA filter. So here's that layout. What you're seeing is the ventilation systems with the VAV box. Remember, ventilation systems blow that air into the space. It blows it towards the floor because it wants to be distributed, and then the return is higher up in the wall. You'll see that in the videos, and I'll point that out. But it's being distributed based upon the layout in this original design of the building and the number of people that were in it. So our first study, standard fresh air, 42 students, 50 minutes occupancy. Remember, ventilation in buildings controls temperature, humidity, and CO2. So can you see this video, Elizabeth?
Mm-hmm.
I just want to make sure. All right, so what you're seeing here is our room down there in B50. And there's going to be a smoke generator right here in the back towards the front of the screen. And then it's going to show its distribution through the space as it moves.
And remember, there is no ventilation on at this point. This is just
Right.
nothing
This one
on.
is before we did ventilation. This runs for about 10 seconds. And it is distributing a smoke that we use like a smoke test when we study ventilation. And we're watching it for the movement. A lot of people have been going through and we're going to model the whole room. We're going to put a CFD analysis in there. We're going to estimate, what's going on. They have to optimize things. They don't necessarily have the furniture layout or the people that are in there. They're not necessarily running the ventilation system. They'll do one room at a time. And the cost and time associated with this is crazy. So it's easier to go in an existing building to go through, run these smoke tests and follow what's going on. And what you're seeing is that visualization of breath being exited. This is over, that 10 seconds, and you see what happens to it. You can see that it rises to the ceiling because it's the same temperature. Hot air rises out of the body, and it accumulates in the space, and it goes nowhere. Why would the system not be on? Well, the system is on. The system is definitely on, but it's only working on It's only working on the fresh air component. The temperature's okay in the building, the humidity's okay, and the CO2 levels aren't. And this is what happens in a normal environment with the kids sitting there. All of this is visualizing what has happened with that exhalation and where it's going. And as it cools, it comes back down, and you can see that. So let's go back. And the next test that was run is turning that ventilation. I took control of the building automation system. I kicked it into high gear. I said, I want to cool this place down, turned on the CO2 sensors, and basically made the whole thing work. And then I ran the same study again.
One thing that's important to note here is the position of the return air vent, which Lee will point out to you that we had highlighted in the image. Because again, that is where the air is being sucked out of the space.
Where it's supposed to be sucked out of the space. And my cursor is over here on the left, and I think maybe draw on this a little bit. It's not letting me. My the vent is over here on the left. All right, so let's show this test. Everything's going and the ventilation is on. You can see it running. You see it rising. It's going up just like before, moved over. Look at the lights. I want you to look towards the lights, and it gives you a much better indication. You can see how the vents that are coming out of the air conditioning here and on the left are blowing it down into the space. That's the job of the ventilation system. It is to blow cool air or hot air, whatever, down onto the occupants to increase their thermal comfort. When we have an exhalation source from that smoke, you can see that it's being blown down onto the people that would be living there. Now, at this point, I pick it up and I move down because I'm moving towards that return air. I'm trying to see how much of this is going over there. Remember, it's supposed to be heading to this little cross area. That's the return thing. But these vents are continuing to blow it down, and it's not necessarily returning in any sort of efficacious manner towards that return air. You can just see when I slow down here that it's blowing it down and recirculating it within the space. I'm over here now into the return air path flow. And you can see that smoke is still being circulated over there towards the back and towards the end. So we have an issue. It's not that anything is wrong in the conditioning or the ventilation of the space, but for resiliency purposes, if we needed to have fresh air in, if we needed to evacuate that air and move it, the air handlers aren't designed to do the air changes per hour like a hospital would be designed. And the cost associated with that is pretty astronomical. So what we needed to do then was introduce a cleaning system, and went through in a space adjacent to this and started working with HEPA filters. And HEPA filters are very important for bringing in, what they do is not just the filtration from the air handling unit that has the filters that were all upgraded and whatnot, but it actually is a high efficiency particulate filter that takes out particulate sizes that the viral can be hitchhiking on, and down to very, very small sizes associated with it. So to demonstrate that, size them according to the volume of the space, assemble them throughout the space, and then set them out to show with the same study, with that same smoke generator, how quickly its removal, to increase the idea of that air changes per hour. So there's the smoke going off there. These little white boxes on the table were the initial one, but you'll see that this one over here was put up on a stand. And why is that? Because hot air rises. And if we want to make sure that we are capturing that exhalation, we put it up higher to be at the level where it would be, not wait till it cools down and enters the desk area. You can hear the return air, the ventilation's all going on with this particular one, but you can see if you watch closely, looking at the area around that and the student desks, that is clearing up. What you see is the smoke in the past is the exhalation, visualization of it moving towards the return vent. So if we kind of scrub this up and speed it up just a little bit, just to make it get to that point, you can see within about a minute, 2 minutes, that none of this, remember I told you to watch the lights, there's no recirculation happening. This has cleared this up, even in less than the 2 minutes that we would want. So once again, these HEPA filters are distributed through the space. They're taking in this exhalation, they're removing that from the space. And this is to compensate for not having the natural ventilation available within it because of the way building and code designs those spaces.
And if you look at the image, you go back just a tiny bit at the end of the video, you can actually see the space towards the upper left, down there near where there are some windows, where we do not have the HEPA filters. That smoke is lingering back in there right. Because it is not being cleaned by the filters. There aren't any HEPA filters back in that corner. And of course, it's not being cleared by the return air vents either. It's just hanging there on the other side of those windows. You can see it in the light.
Right.
The space to the right, clean and clear. Clean and clear. So.
Right. So we went through this. It took about a week and a half to 2 weeks to go through every room in this building. There, people would be occupying it and do this visualization study so that we could come up with a report to make recommendations. So one of the issues with those existing ventilation systems, the COVID-19 impacts and issues, the upcoming infrastructure bill that they're talking about application, the interim guidance is that for COVID-19, you would adapt the existing buildings, calling for avoiding central recirculation within COVID-19 episodes and closing recirculation dampers so it's fresh outside air, return air filters during future outbreaks, Some people, because of this, new funding, infrastructure funding, are talking about hygiene ventilation, meaning we're going to take these mechanical systems and we're going to push them to the limit. We're going to upgrade the air handling. We're going to make sure all of that stuff goes faster. We're going to do this. Just upgrading the mechanical ventilation, because the people making these decisions are mechanical engineers and HVAC and ASHRAE. They want to ensure that the viruses are not being pushed through mechanical systems, but are instead pushed out of the buildings. On campus, we had a couple of studies of UV disinfection within those air handling, but first of all, the air has to get to the air handler to do it. And we had demonstrated 3 separate times that the air is not making it, even in standard practice. Our building was remodeled about 10 years ago, pretty much up to date, one of the better ones on campus, still not able to meet that. The byproduct of using this mechanical ventilation, while you might be meeting one element of resiliency, you're going to be massively increasing energy use. And this mechanical ventilation only response would mean that conventional buildings might require up to 6 times the amount of energy to maintain 100% fresh outside air. And this is setting up a really dire trajectory for global building energy use in the new era. So what we're going to try and do is work with back to what we've learned, that vernacular about operable windows, what we learned with resiliency in Hurricane Sandy. And not necessarily just, maybe in certain instances, it's the only thing you can do, but mechanical ventilation is not. And if you were to compare costs for what it would take to upgrade everything in that particular room and didn't do it with mechanical, but sort of had operable windows where we could have cross ventilation and flush that out on a timely basis, the cost comparison is going to be amazingly different. And you will also see that the building energy use will not go up. So in kind of summary, what was really neat of all of our recommendations and whatnot is in February, taking and assembling all of this guidance and lessons learned and things that were put together. The New York Times had a group of people put together a visualization, and it's pretty awesome, and we wanted to share it with you as some of the guidance is applied to one room in a typical New York classroom, and the progression of things of how it works and what we can do to offset and respond to COVID in a resilient manner. So when this is called up, this is a New York Times. It's a pretty awesome representation. You scroll through it. So CDC is emerging communities to reopen schools. So the T.S. Chan at Harvard School of Public Health teamed with these visualizing experts and air quality and put together these illustrations. So here's a typical classroom, just like we had at the beginning. This is the size, this is the density, 30 students, what a real public school classroom would look like. So in the beginning, just like us, strict protocols, moving wearing masks, desks are 6 feet apart. They went from 30 to 9, they're cloth masks, 6 feet apart, windows closed, the room would lack sufficient ventilation. There's a problem with an airborne virus, and they have these great illustrations. While they're wearing masks, the breath still circulates and mixes around the room. About 3% of the air each person in the room breathes was exhaled by other people. And then they illustrate what happens when we have an infected student, even asymptomatic. Remember, you don't have to be having symptoms. And this is one of the scariest components of this disease. So when you add that infected, they visualize the particulates 0 to 5 microns being exhaled into the environment. Remember, hot air rises, and they trace those aerosols through the room. And the contaminants, the darkest on the right, you can see that legend. It's more dense because it's closer. And as it spreads, following that airflow within the room. Remember, this is all computer modeled. It took a whole team of people to visualize this one space. So within a short time, the room approaches peak level of contamination. This is what we know is exposure and time. Little fresh air coming into the space, and the contaminants just continue to circulate throughout the room. So everybody's all in agreement. Good ventilation is most effective way to rid the space. And the healthy building program that is being recommended for New York City, 4 to 6 air changes per hour in classrooms through any combination of ventilation and filtration. So they've got a window open here. So they emulated, had the window open, at least one operable window to help ventilation even in winter. So let's see what happens. When that infected student starts breathing, the window's open, the fresh air dilutes the contaminants. You know, it's the EPA solution to everything is solution to pollution is dilution, right? Simple and inexpensive measures can make the schools safer. He's one of the engineers that's associated with this study. They achieved 4 total air exchanges by opening just one window, which was dependent on specific weather conditions. And to get 6 air exchanges, they have to do a little bit more. So they added a simple air cleaner. You can see it in the lower left. It's a HEPA filter on a box fan blowing the fresh air into the room, both practical, low-cost options. It's not dealing with the mechanical systems, not dealing with that ventilation, because we know that that's a huge expense, and we know that it's going to have energy impacts. So
pay attention here to the direction of the arrow by the fan, because you're going to see later that there's a direction change. So I want you to note the difference between these two scenarios that play out.
Right. We did that at Gould as well. You know, the idea was we'll blow that air in more efficacious, and all it really does is spread it around. So I didn't show that to you, but you'll see how it works here. With the increased fresh air, filtered air coming into the air cleaner helped dilute the contaminants as they spread through the space. But airflow is one way to understand the importance of ventilation, but we can also look at it another way. It's really neat. They closed the view, and they cut it in cross sections. And what they're going to do is go through that room and show you the density and location. Instead of a 3-dimensional view, you'll see a 2-dimensional view. Because with the windows closed, accumulation in high concentrations, they've got nowhere to go. So we bring this around, and you can see the dense reddish fog shows a high concentration of contaminants spreading far beyond the 6 feet from the infected students. And if the student were sitting elsewhere, a pattern would be different, but the buildup in the room would be the same. And then with the window open, concentration remains densest near the infected student, but the contaminants are diluted in the rest of the room, and the exposure for the other students is reduced. And with the air cleaner and fan, overall concentration levels are at their lowest. And with the contaminants are concentrated at the front of the room where the fan is blowing, and diluted everywhere else. Though they achieve the 6 air exchange, there are ways that you can improve that ventilation in this space. And this is key. The fan is blowing out of the window, not in. You don't want to ever blow air across anyone's face, because that's just going to spread it. So if we were to think about this is windows on one side, but we can also think about cross ventilation. If we open a window on the other side, and amazingly Gould is well set up to do that, is you can simulate this fan by having cross ventilation. They move the air cleaner into the center to be more accommodating, not just waiting for it to get over into the back of the room.
The key here is this takes us back full circle to some of those original examples that we showed you, where there was no air conditioning. Air conditioning had not been invented. And so the design of the building was set up in such a way to allow cross ventilation with windows on both sides of the spaces, so that the air could blow in, blow across to the other side. So we're leading back basically essentially to that here. Yeah.
Exactly, which is why we use those vernacular and historic examples in the beginning. So generally best to put it in the center of the room if you don't know the airflow. So we have space needs for future resiliency. We have expanded modified use of existing facilities, and we have air quality issues. We have to deal with operable windows for resiliency ventilation, access to daylight and natural ventilation. That HEPA filter is used in size to the room capacity. You possibly could use UV light in mechanical systems, but we'll have an increase in air exchanges, and not all air handler units can accommodate it. And the analysis of the originally designed space intent, including ventilation standards.
One thing to note here is that we have to design buildings and spaces to meet health, safety, and welfare needs of the occupants and users of these buildings. And oftentimes, those occupancy loads, or the number of people that these spaces are designed to safely hold, relates back to fire safety and people being able to get out of the building if the building was on fire in a safe and efficient manner. What we're seeing now is that these mechanical systems are designed to handle a certain number of people. And while we have occupant loads that relate to fire safety and people getting out of the building safely, we also have to think about how much these mechanical systems can manage, how many people they can actually handle in terms of the capacity that they have to condition and filter the air in the space. So we have to look at that as a guide here as well, and not just feel that we can put as many people as can possibly fit in these spaces. There are a number of factors that lead to how many people should safely and effectively be able to occupy spaces as well.
Absolutely. So that's the end of our presentation. We have just a few minutes left. If anybody has, I don't see any in the chat, but if anybody has any questions, let's go. Connor has one. Thank you. With air pollution being such a significant public health issue, what measures can be taken to make natural ventilation systems workable in heavily polluted cities? There's actually a really vast amount. And if you look at the systems of that organic structures that are being brought into balconies, extensions of shading systems, even curtain walls that are operable but might have a double skin associated with it, where we can ventilate out and then use an air filtration device before we bring any sort of air quality issue into the building. That's how we do it. It's always easier for the upper stories of a building. We're talking about the ground stories. There's a variety of techniques that are used to filter that air before it comes in, and that none of that precludes the operable windows. Thanks, Hunter. We had fun too. I think we have a couple of minutes left if anybody has any more questions. All right.
Thank you all for attending.
Yes, thank you.